Welcome to Beyond Addiction and the telementoring program at the University of Arizona College of Medicine, Phoenix, sponsored by a grant from Access, our state Medicaid program. This segment will be an orientation to telementoring, what it is and what it is not. When we think of mentoring, we might imagine experts and novices sharing past experiences and advising, or we might conjure up the image of Telemachus and Mentor, a relationship in the Greek epic poem Odyssey that was built on trust. This program will be some of both. Historically, physicians, residents, and medical students have garnered information in a variety of formats. For some of us, lectures, textbooks, trial and error were the only way. More recently, the internet has provided us with more timely information. Case-based learning has provided us with face-to-face opportunity to problem solve. And group sharing has evolved from a circle of people sharing in the same space to Slack, Twitter, and Facebook groups. Bedside clinical rounds foster teaching and learning. Expert to novice, with patient involvement in a positive form, was the essence of academic medicine. Unfortunately, external pressures of confidentiality and RVUs have forced other methods of teaching and learning. To say nothing of the EMR, which consumes each of us to be better transcribers and less skilled at communication. Today, people sharing information is current and accessible. Experts share their practices, novices ask questions, and collective learning is an accessible format. Until recently, this may have been done in a hospital library, doctor's lounge, or charting areas. The internet, with ever-increasing bandwidth and speed, has provided immediate access to current literature that is both research-based and expert opinion. Group learning facilitates more questions and idea propagation. Telementoring is all of that, but from a distance. Originally propagated at the University of New Mexico by Dr. Sanjeev Arora, specifically addressing the care of patients with hepatitis C. The concept was especially important in New Mexico, as many of the patients and their providers were rural and distant from the academic center. Currently, this format is used all over the United States and globally. It has become an efficient way to have case conferences, stay current, and have colleagues available to curbside. What telementoring is not is direct patient care. It needs to be based on trust and willingness to share challenges and successes. It takes commitment to provide de-identified cases to learn from and to stay engaged to build a community. The Beyond Addiction telementoring program will initially focus on pregnant and parenting women with substance use disorder and the Arizona Department of Health Services Addiction and Pain curriculum. We will use the Opioid Use Disorder in Pregnancy textbook written by colleagues who specialize in substance use disorder and pregnancy. Many of the authors will present and will mentor topics of their expertise. For the Arizona Department of Health Services Pain and Addiction curriculum, our own University of Arizona College of Medicine Phoenix faculty who teach the Pain and Addiction curriculum will present and mentor. Participants will engage from the comfort of their office or home using Zoom at a remote interface that allows screen sharing. Cases will be recruited from participants and the academic programs in Arizona. The cases will be maintained as de-identified and in a HIPAA-compliant manner. This is an example of a case list that will be used during the telementoring sessions. The structure of the sessions will be 10-minute presentation from an invited expert, case presentations and discussions for 30 minutes, and 10 minutes of Q&A time with the invited expert. The obvious benefit is learning through the experience of an increased patient volume and the experience of experts. The hope is that it will translate to improved patient care with the objective of improved outcomes for patients. CME will be provided with many of the sessions. To that effect, follow-up surveys will be provided on the implementation of the session learning objectives into each individual's clinical practice. Additionally, it will provide content to help address the goal of educating providers on the pain and addiction curriculum. We look forward to our collective journey beyond addiction. Thank you.